The UK has one of the highest child mortality rates in Western Europe, a study reveals. British youngsters under 5 are 50% more likely to die than those in Sweden. According to a damning report, the rate is also around 25% higher than in France, Germany, Italy and Spain. Obesity, unhealthy diets and smoking during pregnancy may help to explain the difference, say experts. These problems, and England's higher proportion of young mothers, cause babies to be born prematurely, underweight or with birth defects that increase their risk of death by 17 times. The child mortality rate for England was 29 deaths per 10,000, 1.5 times higher than in Sweden. Researchers, led by University College London, focused on the difference between England and Sweden because both have a similar standard of economic development and healthcare. The damning findings, published in The Lancet, show the UK would see 6,000 fewer deaths per decade if it matched the Scandinavian country, using medical data from the NHS and the Swedish Health Service. The study compared the health of under 5s between 2003 and 2012. The child mortality rate for England was 29 deaths per 10,000, 1.5 times higher than in Sweden, where the rate was 19 deaths in 10,000. Lead author Dr. Anja Zylberstein of UCL's Great Ormond Street Institute of Child Health said, while child deaths are still rare, the UK has one of the highest child mortality rates in Western Europe. British youngsters under 5 are 50% more likely to die than those in Sweden. According to a shocking new study, more than 80% of deaths in children under 5 occur before their first birthday. The main reason for excess deaths, accounting for 68% of the greater risk of death in children under 1, is premature birth. Low birth weight or defects such as heart problems. Babies born preterm are more likely to suffer from respiratory problems or conditions such as cerebral palsy. A low birth weight increases the risk of death fourfold. Such problems can occur in young mothers, and England has 4 times the number of babies born to teenage mothers than Sweden. British mums-to-be are also more likely to be overweight or smoke during pregnancy. England's higher proportion of young mothers cause babies to be born prematurely, underweight or with birth defects that increase their risk of death by 17 times. Related articles. Previous one. Next, the heartbreaking moment. Australian scientist. Share this article. Share. If the child mortality rate was the same in England as in Sweden, more than 600 fewer children would have died a year in England during the 10-year period analyzed. Researchers said health officials knew about the breast screening outrage. 104, says A. Overall, the study included more than 3.9 million English births, with 11,392 deaths. Co-author Professor Anders Strand of the Karolinska Institute, Sweden, said the key factors here are likely to include Sweden's broader welfare programs that have provided families with an economic safety net for over 50 years, the free and accessible educational system, including early childcare, and public health policies for many lifestyle issues such as obesity, smoking and alcohol use.
The freak's at.